threw a bunch of money at you all at one time, it'd be harder for you to figure out, okay, what do we do with this? Where does it go? It's meant to be a planning year. And so right now, if local health departments aren't quite ready to know exactly what they need to do, that's okay. That is expected. And we have people lined up to help the health department with that funding and ways that they could possibly best funnel that based on your specific county metrics. Let me back up just real quick. So my job, I should introduce myself. So I'm Sheila Paul, and I am one of the new regional administrators for IDOH. So it's a brand new area for us. So before, I don't know how much you know about the health departments and kind of their inner workings, but there's the state that kind of will send down guidance, and the local health department, it's up to them to put that into practice. What has happened over the years is a lot of times local health departments have a hard time getting in contact with subject matter experts at the state. And the state has recognized that. So they put us here at this level to answer questions for them and to be that immediate person to kind of get an answer if they've got a question. You know, for example, I don't know if you guys have heard, but a few years ago, they started requiring tattoo inspections for tattoo parlors. Years ago, that was never a thing that was required. And then they started saying, hey, you should be really doing this and checking out tattoo parlors for public safety. And of course, local health departments had a lot of questions about how do I do this? What should I be doing? And so if they didn't know who to contact now, they would contact me and the team that we're building, and then we'll help them. The team that we're building is, so I'm the regional administrator. There's a public health nurse, a maternal and child health specialist, and a school liaison specialist, because maternal and child health, and as we know, the youth is an area we really want to focus to get them started in the right direction young. So that's one part of it. Another part of my team is a finance analyst, so somebody to help the local health departments building budgets, figuring out grants, that sort of stuff, figuring out invoicing and how to do all of that. Also, we'll be hiring a data analyst, which I think is key, because how do you know what programs you need to put in place in your community if you don't have the data to know what our biggest problems are, right? So I know I saw on your county metrics, one of your leading causes of death is accidents. That's a very broad. So what is it? What type of accidents? Is it farm accidents? Is it swimming accidents? Is it motor vehicle accidents? What is it? And so the county data person that we're putting in place will help the local health department determine that and build programs around that. So I think that that's excellent. So that's me. So as far as this funding goes, basically, it's important that, again, like I said, the money is going locally to what you guys or your health department or your county thinks is the best way to go about it. You have to opt in by September 1st. So that decision does have to be made by September 1st. There is a survey that the health department can complete to submit something that shows that the commissioners have opted in. So that can be as simple as the minutes, or it could be, we have a proclamation that can be signed and you can sign that and that can get submitted to the state. At the same time, September 1st, a budget has to be submitted. Now, a lot of people have said to me, how do we even know what to put in this budget? Like, this is too fast, right? This is too fast for us to figure out. We know that. We 100% understand that. And it is very broad, very high level. So for example, we're not asking you to say we need to buy 100 reams of copy paper. We just are saying this is about how much money you want to put into supplies. So very high. So also, I don't know if you guys are familiar, but right now the health departments have what they call local health maintenance fund and the trust account. So that is what this is replacing, this Health First Indiana fund. So currently, Stark County gets about $50,000 with what we're calling their legacy funding. So that will continue if you opt out. That's the funding that the county will continue to get. I don't know if you guys have seen the numbers, but for 2024, you'd be getting a little bit over $254,000 if you opt in. The great thing about that is that it's not a grant. So it's non-reverting and non-diverting. So
hold on a second. You said 254,000 if we opt in, or if we opt out? Because we're continue to get that amount for the local health maintenance and the trust account, whether if we opt out, right?
I showed that your local health maintenance and trust account currently is at 50,303.
33,139 and then 17,040 something.
Okay. Yeah, so that would
But
be
yeah,
about,
so it's
combined
around the
about
50,000,
50,000.
yep.
Okay, yeah, absolutely. So that is what you would continue to receive if you opt out.
There you go, okay.
Okay,
You said opt-in, that's what confused me, because I thought we were like around 701,000 that we were getting if we opted in.
okay, yeah. Sorry, I'm
All right.
also talking fast. I'm used
Nope,
to the.
I got you. I just
Got a
want to make
long
sure I'm hearing
agenda.
it.
They're like, come on, lady, get going. All right, so if you opt in next year, it would be around 254,000. Like I said, that is non-reverting and non-diverting. So that money does not go back to the state. It doesn't go anywhere else. It stays with the health department. And if they cannot spend it in the first year, it carries over to the next year. So that is one thing that's kind of nice. Then the second year in 2025, it pretty much doubles, and that would be at about 508,000 is what they would be getting the second year. Now there's,
Even if we didn't use the full amount the first year.
Yep.
We'll still get that.
yep. So
Okay, I've got a question real quick, sorry.
Yeah.
We're getting 254,000 next year if we opt in?
in 2024,
So 2024, we get 254,000 if we opt in?
yes,
Because that's pretty much what we're getting now.
you
I'm like
get
at 238, 242, I think now.
Well, you'd still get your, if I understand it correctly, you'd still get the 1159 tax portion. Yes, so you.
Because we still have to provide that as matching.
This is on top of your 1159.
yes,
So the total amount for 2024 is only going to be 254. It's not going to be the 701,000.
No, it's,
Yeah, it'll be 254, which will replace 9133 and your other fund. But
Gotcha. So
11
instead of getting that $50,000 that we
Yes.
were getting before, now it's going to be 254,000 in
yes,
its place.
plus still the property tax money.
And then on top of it, we will get our 185, 200,000, whatever
Yes.
for the 1159.
Yes,
Okay, so it's less than the 701,000 that we had talked about a couple months back.
correct.
Okay,
yeah, I don't know about the rest of your guys' budget. All I'm talking about are Health First numbers,
I
and
think
then
it's when the
your
numbers were
legacy.
first started being played with.
there were a lot of preliminary.
April, May, the numbers that were coming out where we were getting 701,000 the first year.
You are, because you got the next year, is what, I think it's confused.
Okay, so originally there was a minimum and a maximum number you could get through this Health First Indiana money, because they weren't sure how many counties were going to be opting in. Because what happens is if a county doesn't opt in, that money goes to another county. So they thought, they weren't sure how many counties were gonna opt in at first, and so they were giving you a minimum and maximum. They are thinking everybody's gonna be much closer to the minimum now because so many counties are opting in. I think today we are at 68 counties. So yeah, that's probably where we're getting some different numbers on the highs and the low ends. We're just dealing with the minimum numbers now, so you know. So for that, at least 60% of the funds has to go towards what we're kind of calling health services or preventative services. And then up to 40% can go towards regulatory services. So that might be your restaurant inspections, your tattoo parlors, your vector control, that sort of thing. There is a 10% cap on what they're calling capital outlays. So that would be land, building, and vehicles. So let's say that the health department, I don't know this health department, I haven't been here before. Let's say they're throwing out scenarios. Let's say the health department, they're like, we don't have enough space, we need a bigger space. And so you've thought, okay, well, let's build them a building dedicated specifically to the health department somewhere else. You can take 10% of that money from this year, roll it over it year after year until you get the amount that you need to do that building. So that's just a nice thing that you have available to you. You can't spend more than 10%, but you can roll it over year to year to accumulate to be able to do that. So now the core services is what they have to build their budget around, is providing those core services. And I don't know if you guys have seen the list, but it's things like maternal and child health, preventative care, trauma and injury prevention, things like that. So the services and what they're spending the money on has to go towards those services. So for example, I had a county ask me if the coroner could purchase, and I'm going to tell you, I'm going to use the wrong language here, but a lift of some kind for the coroner's office. And no, that wouldn't be allowed for the health department funding because that doesn't meet one of the core services of the health department in this funding. So there are certain things that you can and cannot do with it. But somebody else asked, could we partner with a local foundation and provide bike helmets to children? Yes, that does meet the core services because that's trauma and injury prevention. So you could do it for something like that if that is, you're finding a lot of injury due to bike accidents. You could
I've
do
got the car
that.
seat program in place now, so somebody gets in an
Very simple.
accident, they get a car seat if they
Yep.
don't have access to a new one.
Yeah, so this is something where you could expand upon programs also that are already existing. So some of these core services, the health department is already doing. Some of them, they may be doing a little bit, but could expand. And some of them, they may not be doing it all. And by opting into this funding, they would be required to start offering those services. Now, again, we don't expect it to happen overnight. We don't even expect it to happen next year. So ideally, by the end of 2025, when they've got that full funding, they will have a good leg up on providing all of these services, a good plan in place for how they're going to do it. We also don't expect them to do it all by themselves, because I know in my county, when I first brought this to the attention of our commissioners, they said, we can't add to your staff. We can't add 30 more people to your staff. And I said, of course we can't. That's not feasible. But we have great partners in place within the community who are already providing some of these services. We can work with them to give some money to them if we feel it's necessary to help with those services. Why reinvent the wheel if somebody is already providing that?
Well, that's
service?
what was an eye opener for us at the state call meeting, was when Dr. Weaver talked about being able to work with FQHC. We
Yep.
have a really strong FQHC already in Stark County.
Yep,
And the other shocking thing for us was the map. We were the darkest red on the map. So I mean, we have needs in every area: smoking cessation, obesity, childbirth weight. I mean, I'll just go down the list. We're almost last in every one of those. And so we need help. But obviously, trying to build, have Frank build this huge health department in 2 years. I mean, that's too daunting, rather than having he and Dr. Brown and people manage that. But we already have resources
Yeah.
here. There was one other thing that Dr. Weaver mentioned in her presentation.
Mhm.
She said she would get back to us. She has not been here yet for her visit. She had EMS on there, and I was just still wondering what is allowed to be bought for EMS from those dollars.
so originally that was in the plan and legislators took that out.
Okay.
So there are some things you can still do if it'll meet one of those core services. So it depends kind of where it falls. So for example, if it has to do with emergency preparedness, and let's say radios need to be purchased, that would fall in to help the core service of emergency preparedness. So there is some ways to do that. But some of that money, I don't know if you remember, but they did cut about $25 million, I think, from the budget from originally. The state did, and that was what that cut.
And we also have a big mental health problem, especially with addiction. And she mentioned that there were things that we could do with that.
Yes,
That would qualify also.
so there was Senate Bill 1 that focuses specifically on mental health, and they got substantial funding. And so that is something, I just was on a call this morning and I said, health departments are going to need to know what's being provided through that bill,
Right.
so that they don't duplicate services when somebody is working on that. And plus, I mean, we all know that's a big concern in every community, mental health right now and ongoing. And so there is funding for that. And so as soon as we get some definitive answers on what communities have planned, but Stark County is also getting funding for mental health specifically. So I think we've kind of entered into the questions portion for the most part. Going back real quick, just real quick about your budget building. I don't know if I'm still on there. The first thing I would do when you're building out your budget is first get that legacy funding over there, right? Whatever you've been spending in the past in those two accounts, get that over to the new budget. And then start evaluating what services do we offer, what gaps do we have in our community, and where might we want to put more of that funding. We know it's going to change. It's okay with this if it changes. I know council, I don't know how many council we have council on here. I know you guys don't love it when they come back for appropriations and making
So we
changes.
appropriate it and help them. Okay.
Yeah.
I was wondering how that worked. So.
Yeah, so you'll still approve it like you always do all of the budgets, but I do want council to know that those numbers will change for them because this is a lot happening very quickly for them. So I would anticipate they may need to come back and say, okay, we changed our mind, our money isn't best put into this, we need it to go into this line item instead. So that would possibly be happening.
Are there any rules about not investing that money?
You know what, I asked
haven't
that
seen
question
anything.
and I haven't gotten an answer to that.
I haven't seen it in any of the law.
When I first asked it, this is what I was told is. We want to get that money into the community and start building programs to help the community. So, and to help improve the health. So I think, the investment part could be in like carryover possibly, like, hey, we've got this big thing we're gonna want to spend the money on in the future.
Yeah.
We can do that.
We can do a 6% 6-month CD and,
Yeah.
make $8,000 off of it and put more towards the program.
So I'll ask the question, because I've asked it before and I haven't gotten an answer. The first answer I got was, we want this money going back into the community to
Sure.
build programs as
We-
quickly as possible. So,
Okay.
so I'll ask that question again.
You said if we like working on a building or whatever, we take 10% right away. And we put that in that fund, I believe. Go with next year to add
Well,
to it.
yeah, that's what I'll ask, is if you pull that 10%, it's gonna go into a carryover if you could invest it. So that you could build upon that income, yeah.
Any new positions that are created with this money, is that where I hear that they have to be posted for 30 days?
Yes,
But any new positions can be created with this money as long as it goes toward the core services?
yes, so let me be clear about one thing. So anything that you're spending this funding specifically on has to go to the core services, and any contracts or employees that you hire that are new have to be posted. It doesn't mean, so for example, let's say that you move all of your employees over to Health First Indiana, and things that are existing, you put into this fund, you move them all over there. And you're 1159, then you've got that money to do other things with. There's no requirement on 1159 to do those, or to do postings.
Good idea.
It's a really good idea. I just wonder how long the state's gonna allow it.
Right. What happened in 2 years when they don't renew this program?
So that's,
And we got a building going and now they have to come out with the money to finish it or abandon it.
right, that has been a big concern for every single county, my county included. And so here is what I will say. We can't see the future, right? We have no idea what's gonna happen. But this did not pass with a narrow margin. It was overwhelmingly bipartisan and passed with a large margin. Plus, now we're already at all of these counties who have opted in, and I think we're only gonna have a few, I don't know exactly how many, but we're hearing about more and more that are opting in. That is a significant amount of money to pull out of health departments. I just personally, everything that I am hearing, that is not expected, that is not what's going to happen, and honestly, what I'm hearing is they're gonna go back and ask for more in 2 years. So, that's a concern, it's always a concern with all of us when we work.
Well, the state can change their tide. I mean, when I first started
They
on the
can.
council years ago, we had questions about if we had shortfalls, they said lay people off. I mean,
Yeah.
that they change they'll
I
change
know.
180.
I know, yeah, I mean, and like I said, we can't see the future, so I would also encourage you to be cautious in what you're developing also, right? So,
Or use services. I mean, if there are services in place.
right,
So I have a question for you. So there's 68. There must be some counties that are small like ours. Are they hiring a whole bunch of people and creating a big,
No.
are they using their local like FQHCs?
Most of them are.
Okay.
Most of them are partnering with other agencies, another county, a lot of counties, but not most, several counties that I've spoken
That's
with
how we get out.
are
of it.
creating advisory
Fails.
boards.
Yeah.
And so they'll have an advisory board that basically, let's just say FQHC goes to them and says, we've got these programs. We think that we could expand it and offer this with $50,000. And so the advisory board listens to them. I highly would suggest it kind of an application process, something like that, a scoring rubric possibly. Then the advisory board reports to the Board of Health and says, okay, this is what this FQHC is offering. And then you have several checks and balances along the way so that, and not that the health department would do this, but just so that there's not somebody there saying, my sister's got a great plan, I'm gonna give her $50,000, right? So that puts some checks and balances, but most are going towards partnering. You have, honestly, I think you have to. And nobody can build up their staff. I don't know how many of you guys have.
It's also a way out if it does crash.
Right,
One of my council that couldn't make it today wanted me to ask if any of this is being dedicated for schools and health in the schools
Yes.
specifically. Is
so
it separate from this or is it included?
it's included. So school health liaison is something that has been around for the last 3 years, and it's a grant that the health department could have taken. I think about 50% of health departments participated. So now it is a core service. So they are going to be required to go into the schools, work with the schools, and develop the wellness programs, smoking, vaping cessation programs, mental health programs, different things like that within the school. Like I said, youth prevention is where we got to start. And so that is definitely a core service.
So early on in the process, I heard things mentioned about KPIs and how that needed to be developed. How much of that, defining those KPIs are we going to be responsible for, and how many are we going to basically inherit from the state along with these funds?
Okay, so every core service has a KPI assigned to it. And that is a measurable metric to say what the health department has done for that service. So for example, for public health nursing, one of them is to have a full-time public health nurse. So meet that KPI, you're done. Now, the local level will want to develop more KPIs to help their own KPIs to make sure that they're meeting, those are key performance indicators, to make sure that they're meeting the state level. I'm trying to think off the top of my head what one is. So for example, in food service inspections, it is that they should be conducting risk-based inspections. So that means, for example, you have a candy store, maybe you're going to go in there once every couple of years, but then you've got a Mexican restaurant that's doing everything, lots of food prep, you're going to go in there 3 times a year because that's a higher risk. So local health departments should be doing their inspections based on that. So at a local level, they may develop their own KPI that says, okay, we're going to do candy stores once every 2 years, we're going to do fast food places once a year, we're going to do your high risk of places 3 times. So that's kind of how that works. So your local KPIs, one, do whatever it needs to do to meet the state KPI. But also whatever it is locally, you decide you want done. So maybe locally, like let's go back to the bike helmets. Maybe there's no state KPI for bike helmets for head injuries due to bicycle accidents, but locally that's your thing. You can throw that KPI in there for your local metrics. Now, if you don't meet it, it doesn't go anywhere because that's just your local metric that you have set up. Did I help answer?
For the most part, the state has completed their list of
Yes.
KPI. Because that's kind of what I've been waiting on to see before I make a decision. What kind of?
Email that to me. I've got it pulled up.
Yeah, because I personally want to see what we're required to report on before we accept the money.
And just so you know, also, that is something they do not expect to happen right away. They don't, ideally by the end of year 2, hopefully they have made great strides towards meeting those KPIs, especially with that second year increased funding. But year 1, it is not an expectation because a lot of health departments don't even have some of these programs in place at all. And so that's,
Well, it's not that big a concern with it being non-reverting funds anyway, so,
right.
but yeah, I'd like to know, what we're expected to,
I will.
from the state.
I will email those to you if you get me your email. Okay. Before we're done. Okay.
It'd be nice if we all could get that.
Sorry, I was gone for a minute, so I missed a chunk. Did we cover it all as far as like what the other requirements are other than just the KPIs? Is school liaison, having a school liaison position a requirement for the
Yes,
funding?
that would be a requirement. It does that. Now, that doesn't mean it has to be a separate person assigned to school liaison. It just means that you have to have somebody designated within your staff who is providing that.
So I can just continue as school liaison as we have without
Yeah.
having to hire a position,
Yeah.
because my schools do not want somebody coming in and doing anything in those.
So for you guys, it might be starting to try to build those relationships within the schools, or if there is somebody they don't mind locally coming in.
I've got relationships, they just they don't want the extra help.
Oh.
As far, you know what I mean, that's just where they're at with, that's the conversations I've had with them. I mean, those conversations may change next year, I don't know, but
Right.
at this point in time, they don't need help with vision and hearing screenings.
Oh, yeah.
Our immunization rates aren't abundant enough to where we need to be going into the schools to vaccinate kids. stuff like that. School liaison, then the other one was preparedness. Do we have to have a full-time preparedness person?
I'm gonna have to read the KPIs. I don't believe it's a full-time person. Do you take the grant currently?
No,
No, okay. I believe you have to have a part-time person for preparedness, but I will send over those final core services and KPIs to you.
because those are my only two concerns, especially since now, I mean, like I said, I was under the impression we were getting like 701,000 for next year. If it's only going to be an additional 254 on top of our 1159, that's even less money. And so to have to push that towards
Yeah, I know.
Okay.
two other positions that we don't currently have, when I'm already pushing to try and get a full-time food person. Since we don't have one.
Do you mind, Frank, if I talk with Rachel about your budgets and your numbers? Because that, it just isn't, it's not computing in my head what you're saying on the numbers. So I just want to make sure I'm not confusing the situation and saying something out of turn on that.
That's fine.
Okay.
Like I said, I have not seen anything showing a lesser amount than 701,000 for 2024. As far as what our funding was going to go up to.
Okay,
So if that did change the word, like I said, instead of local health maintenance and trust account funding that we normally get, we're going to get this 254,000 in its place. That's all
Okay.
I'm trying to figure out is
Yeah.
where the
I'm
difference is coming.
I'm not
out.
sure. Where did you get the $700,000 number from?
Dave McCormick, David Hopper, those were the
That was
numbers.
on your one sheeter?
Those were the numbers that they were sending me. Yes.
Okay. Okay, yeah,
So,
I'll
I mean,
take a look
good
at
deal
it.
more than what we're talking about here.
Right.
Which bothered me anyway, because I don't, again, same thing. I don't want to be the one to make the decision on where all this money should be going or anything like that. I want money, but I'd like programs. So,
Absolutely.
but either way, sorry,
Okay.
continue. I just want to make sure everybody was aware that there are some requirements as far as possibly having to have some positions added beyond the food position.
Okay, what other questions do you have?
Do those positions have to be staffed and can they be contracted?
Most of them can be contracted.
You've
Now-
seen the contract requirements as far as we've got to publicize it for 30 days. It has to be, contracts got to be like an open public contract, blah, 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 that kind of stuff. So I think that's not something that's out of the ordinary or anything. I just haven't got a clue who the hell I would contract with for preparedness. So that would be something I would look at state to say, give me a list of some people that are on your good graces as far as who would be reasonable to contract with. Something, I don't know. It's kind of like just a head scratcher for me.
Yeah, we did put out a list of local partners. I'm not sure if that is on there, but I can also send that to you because it has a list of partners within areas that you could possibly work with.
Yep.
So I can send that to you also. It's not an extensive list. There's clearly going to be more available, but those are ones that we know of.
Yeah.
Dr. Brown, is this something that you're wanting to opt in? That you're wanting commissioners to opt in? You think this is a good idea?
I don't have an opinion on that yet.
You don't have an opinion on it?
When is Dr. Weaver coming to meet with the health team?
Mid-December. Isn't that what you told me, Sheila?
Let me look at my schedule. Of course, let me pull up my schedule and I can tell you. It's not going to be before September 1st. I can tell you that.
I was hoping, I
Yeah.
kind of got the impression when we were at the meeting, because I asked her specifically and put her on the spot, the more needy counties, that they could have their entourage and come out and see the more needy counties. I'm upset about that.
Hmm.
That's not happening.
Well, a month and a half ago, that's what I was basing everything off of to try and get this meeting set up before I was out of the office. And that was, the answer that I got was it would be like mid-December before Dr. Weaver was planning on coming to Stark County area. Somewhere
I
around
mean,
there.
the good thing is if you did opt in, they're not really expecting much from you for the first year. This is, like you said.
If the reins are going to be that loose, I haven't got a problem with the opting in. Again, it's just a matter of, I am also a member of, resident of this county, so how the money is spent. I see it both ways. As far as just turning down the money, I would be upset because we can put that money to some kind of use, but I want to see it used wisely.
Right.
And not just, because we've had several counties in a lot of the discussions that we've had, can we buy an ambulance? Can we buy a lift cot? Can we buy this? And it's like, it's stuff that doesn't apply towards increasing the public's health.
Right.
I was told to ask you, since we can't use it for EMS, that there is a grant coming up to buy in.
I don't know. I can find out. And send you an email and let you know.
Some of the conversations I've heard, sounds like some of this money kind of maybe trying to get diverted so as that it can be applied towards grants for EMS and that kind of thing in certain areas, but there's been nothing concrete in any of those conversations yet.
For each county.
I think I have heard that too, but I don't know the specifics, so I can't speak. on
Sounds
it.
very similar to an FSSA grant that was earlier this year.
Right, I would-
Yeah, it would be nice if they did it again.
right. And they act like they don't, and she might.
Like I said, what we're going to spend the money on, and then I guess one of my fears is after 2 years, are we still going to have this funding available? Or is it going to be a matter of what we didn't spend these 2 years coming up is what we'll have left over to try and continue to fund anything year 3 or 4?
There's no guarantees with government budget.
No,
That's why
never.
Services.
And Sheila, has there been like any talk as far as like, I'm sure there hasn't, but I mean, like, so year 3, this funding does go away. Are we going to go back to local health maintenance and trust account funding since that's all tobacco settlement money?
That conversation, like you said, hasn't taken place because all indications
Yeah,
are.
everybody's all
well.
hopeful that this is going to continue on.
But everybody, if you opt out, you get that legacy amount that that would just be an assumption it would go back to that amount. I don't
Okay.
know, because clearly we're anticipating it will continue.
Have any counties opted out right now?
Mhm.
Why?
So one of my counties has opted out, and it was because, I don't know if you guys are familiar with Fountain Warren, and they were together. They were a joined county and they split. And so one of the counties just felt as though they did not have the time, the staff to get ready for this year. They are planning on doing it next year. They just,
By next year.
yeah. And so that's the other thing to mention is you can opt in and out at any point in time. So if you get in and you're like, whoa, this is not what we signed up for, this is not what we thought was gonna happen, it's too much or whatever, you can opt out. And likewise, you can opt in if you decide not to do it this year. But again, that money would go to another health department for this year and you would be back to your legacy amount.
Do you know how the disbursements are gonna work? Is it gonna be monthly, yearly?
It's twice a year.
Twice a year.
Mhm. So just like currently with the local health and tobacco, how you get one in January and usually one in July, then in June, it would be the same.
So even if we opt in and don't use it, whatever, we're not gonna be bad on us, right?
No, they won't take that money away.
Right.
Yeah,
And it sounds like it's a little more flexible than the first meeting now with that,
does
on
it?
what we can use it on.
Yeah.
Yeah,
so-
So everybody at the table's aware too, as far as the 10 core public health aspects that we're supposed to be we touch on all of them anyway. It's just, it's a matter of how much. When it comes to tobacco cessation, I don't have any programs in place for the county, but I refer them to the 1-800-QUIT-NOW number through the state.
Right.
As far as, I mean, I can go on like that with a lot of the stuff. As far as maternal and child health or anything, if people are eligible, I refer them to WIC. If they're not eligible, then we don't really have any other services in the county, so I'm referring them back to their family doctor. So that's when I'm getting them in contact with either Dr. Brown's office, they don't have one, or HealthLink, one of the federally qualified health centers, or the Rural Health Center that we have in the county.
Well,
So, I
hopefully
mean-
the schools will participate. I mean, there's a lot of gateway activity going on at
Mhm.
people of that age. And that is one to address it.
Absolutely.
And the high rate of deaths, that kind of thing. Yeah, I mean, you're getting into age base. So if it's a 20-year-old, then that's 55 years of life lost. That's why we're ranking so high, is because we have those lower age lower age deaths that are occurring. And it's not that we have that many more, it's just that per 100,000 population, that's where it throws us up there on the charts. I'm not trying to justify the deaths in Stark County in any way, but just so we've got some perspective as far as where some of these numbers come from.
Well, I mean, there's a need for it, right? Except, I mean, we are.
Can you also send
at the
me
bottom
a,
of it.
so the opt-in, or,
Stay
you know,
on.
the sample template, yeah.
I think it should be an agenda item in our next meeting, like the actual. Yeah, because I do want to see the KPI stuff.
Yeah.
They're asking for that for 3 months.
We're a tan on that.
Hmm.
We're a tan.
Okay, so I am sending you, can you invest the funds? A grant, are there any grant coming for ambulances, core services and KPI expectations in the draft proclamation? Anything else?
We're gonna be best friends.
That red cap survey, the link for the red cap survey that the health department has, can you send that to me, Sheila?
Is that to you? Uh-huh.
That way, whatever happens, get hold of me as far as whatever the decision is or whatever like that. I can either get this red cap survey taken care of, or I can have Kim over to health department take care of it. As far as getting it done.
Kim's here today listening too, Frank.
Yep.
Yeah, you should do a pan and show them everybody in the room.
Right upside down.
Well, if you can help it.
Oh my god.
Gotta
Oh. What you saying?
Go.
Let me find your employees, Frank.
All two of us.
All two of them.
Just in case people start to ask, none of those funds are for like jail inmate wellness.
I
Since
mean,
the health department has nothing to do with the jail anymore. I mean, when you start getting into jail inmate wellness now, like as far as like I've had state come in and do hepatitis A vaccinations for inmates at the jail.
I was thinking
before.
dental, I mean, there are some things that, you know, that
so again, that would go back towards what you guys decide locally is the best way to spend those funds. And does it meet the core service? There's no requirement.
it's not,
There's no
the jail isn't
policy.
excluded.
It's not excluded.
Not
But it's
excluded,
not-
however, there is a
not
contract
mandated.
medical service with the jail. So as far as like with certain things, if it's public health related or anything like that, then I have absolutely no problem trying to get some funds pulled one way or another to help with whatever the situation is. I know last time we did Hep A, I think we vaccinated like 38 inmates, got them at least their first dose. So I mean, I thought that was pretty good turnout, but
I'll be sitting back there if you have any more for me. I won't take off.
Thank you.
Thank you. Thank you.
thank you, Sheila.
Thank you.
You know what, one more question for Sheila though. Is there any possibility of Dr. Weaver reaching out to Dr. Brown sooner though, just to, so they can have like a quid pro quo, like?
Would you like
Is that
that?
possible?
Okay, yeah, absolutely.
I think that's important. I mean, he's our leader, you know, besides Frank. I mean, I think it would be nice if,
That way he
Thank
can
you,
reach
Todd.
us quicker.
well, I have to admit, I was pretty impressed with Dr. Weaver. I was a little skeptical. I mean, I always feel like.
Weaver's good. She's always been good. She was awesome through COVID and everything like that. I mean, she's very knowledgeable and as far, especially with the programs, policies, anything like that. She's been on top of it.
The initial stuff was very Marion County-esque that we saw on this program. You know what I mean? It was big county structure. And once we met with Dr. Weaver, I felt a lot better about the program.
Mhm.
Okay.
Yeah, unless we wanna.
Got a question.
Do you have anything for everyone else?
And honestly, guys, whether you opt in or opt out, I think we still need to have like some type of a community meeting between the doctor's offices, hospital. Have a get as far as what core services need hit the most.
There you go.
And some type of survey, something. I mean, we've done them before in the past, but they were pretty vague and generalized. So we were getting a lot of, dogs running loose versus, trash in the yard. So if we kind of can focus it to like the health needs for the county. And because I know if you look at like county health rankings or anything like that, the numbers are, again, they're kind of skewed because some are taken from this set of particular years, or some are taken from this particular part of the population. And I would like something a little more focused with people that are boots on the ground kind of thing.
There were some good studies out there, though. We did some with the Stark County Economic Development Foundation. There was the Owen County study with the judge that talked about mental health. I mean, there are at least 5 or 6 strong powered studies that included Stark County that gave a good representation of where we're at. You know, I mean, it was shocking to me. And there's a lot of metrics that have to do with this, like how many dentists you would, things that you don't really think, you don't really think about dentists, but I mean, they said we should have like 20 dentists.
It's just some of the numbers that we're talking about today. It's not near as much money as what I was worried about trying to figure out how we were spending. Like I said, going from $240,000 a year with my 2 grants and what I get from 1159 to going up to $701,000 for next year. It's like, what am I going to do with that $450,000? Whereas now we're only talking about it's another $250,000 on top of the 1159.
It was 450. People get.
So I mean, it's something.
Let's get people helping in Stark County.
And it's going to be a hell of a lot easier to spend.
Right.
Does anyone else want to inform us of anything like this?
I just got one thing.
Yes.
The last 2 years, a loose group of people are studying transportation, health, and need. We probably have statistics that we have gathered over this time that would help you make a decision. I mean, and this. The 15th, we have a meeting at 10 o'clock. Anybody'd like to come, you're more than welcome. At Community Services. You have a very diverse group of people that see everything that happens in the county. They've all got a heart for the county, and it might benefit you to attend or listen, or even will get you our minutes. There.
Rachel, could you send us an email on that, please, so we don't forget? In case some people do want to come. Sorry.
Now, is this Thursday, you say?
Thursday the 15th at 10 a.m. And give us a heads up. And I'll make sure I have a large enough room.
Tony wanted to know if there's going to be donuts.
Yeah, any donut? You can't go to a meeting about health without donuts.
You're over.
At your community services building.
Yeah. Culver Road.
You're at this meeting. No donuts at this meeting. That's all I was getting at.
Oh, I had some in the hallway. So.
You at least want to register for the record who was here. I'm just saying, I don't know. I mean,
I think it's a good idea.
just in case the
Yeah.
community asks us, like, who came to.
If you could up to that, Rachel, that would be great.
Sorry.
How about I just create a sign-in sheet?
There you go.
All right.
It's an adjacent point as far as transportation or anything like that. That's one of the problems that we have identified in the past with this county as far as like health needs. Everyone's having to go out of county. And so transportation becomes a factor. And Council on Aging has been able to provide help with some of that, but I mean, their resources are limited as well.
Well, Frank, I can attest to, this is Melissa with Healthlink. We've gotten grants through Uber and some other places that we are trying to even get Uber drivers and stuff in this county. We've had to revert to getting gas cards and pay for
Yeah.
taxes directly just to get people to care. Because there's just the specialties that they need are not in this community anymore. And so we're doing our best to connect and go through County on Aging, but there's only so many resources we can.
I'm aware. I'm well aware.
But we are capitalizing on the grants that we've gotten for all of
Yeah.
our locations to try to take advantage of that too. So,
No Uber and start.
yeah, we cannot use Uber here.
We can't
Because they
use
get
it.
straight, no, we could,
Oh,
but
right.
there are no drivers.
Oh, right. I didn't know we didn't have any
And then
drivers.
we go
I
to
use it
some
everywhere
beaches
else.
places and they get stranded. And we have to find a way for them to get back.
I wonder if that's something community services could look into, use a smaller vehicle, not always. a bus.
Community services is running into the same situation where they're dropping patients off and then they're at that appointment for like an hour afterwards, waiting for. Because community services is out picking up other people from other appointments and that kind of thing. So I mean, it's something they run into as well here in the county.
That's
If
not
they-
a new problem.
Yeah, I mean, it's not uncommon. And so that's it. I mean, it'd be great if they had more drivers and they had more vehicles, but then you're just talking about funding.
We do need drivers. And right now, we're working on a vehicle that will not have the restrictions that Kirsty gives us.
And just trying to maintain any type of COVID protocols during the COVID years, it really hit council on aging hard as far as with the drivers and everything.
But hopefully we'll have a vehicle without the restrictions to help.
Yep,
Well, I mean, if some of this can go towards actually having some services or supplemented services that are closer, maybe some people won't have to ride so far for some of these things too. And they can get them right in Stark County, in one of our buildings. Maybe. That's that. For now,
So move. Thank you all for coming.
Thanks, Frank, for being online today.
Yep. Thanks, guys. Glad we had the call.
I just want to speak. I would introduce myself. I'm Scott Ellis, the Chief Nursing Officer for Northwest Health Stark, and Lori Bridegroom, Director of Nursing. We'll be glad to participate in any way that we can. I've been here a year now, so I'm not originally from here, but do have a lot of experience with public health. I came from Iowa, and the hospital that I work for actually provided public health for the county that I was the CNO for the hospital at. So I have a lot of experience behind that, but we'll be glad to help participate in any way that we can with any action. So one of the things that I noticed is that I didn't see a community health needs assessment that had been done for a while. I saw one from 2015, 2016. That was the latest one that I could find.
We have one that includes.
I think that's one of the last ones we've done. It's been that
Yeah.
long. With
So that's
COVID and everything else like that, there's not been an opportune time.
Right. And so that's pretty old data to try to.
It's still pretty consistent for the county, though.
Probably hasn't changed a whole lot, yeah.
Not a lot,
So
not a
things
lot
we've
at all.
talked about. But
I mean,
but it
what
was-
the things that have changed from that data would be, we've lost doctors. You know, we've gone from 2,500 to 3,000 patients per doctor to where we're well over 5,000 patients per doctor in the county now.
Yeah, and Lori and I were looking at some data. You brought up dentist. There's actually saw some data where there was one dentist to almost 12,000.
Yeah.
Patients. So there's about 2 dentists for the entire county. That's one of the things that we noticed. But you think about something like that.
2 dentist offices.
That alone, could you take some of the money and try to recruit a dentist, or share a dentist from another county? There's lots of different things you can go from
If
that.
there was more money.
Looking at.
Or is there a way to supplement the cost for people when they is that something that a type of program that could exist too?
Yeah, I have several counties who are doing what they're calling a hardship fund. And there are parameters around how that money can be used to help offset the cost for whatever services it is. Again, that's where an advisory board, like you were discussing, I think really does come in.
HealthLink's got a mobile dental unit too, it's been in the county several times, that kind of thing. It's just, but again, it's a matter for their patients. So that's where I try and stay away from. I'm not making you go to HealthLink. I'm not making you go to Brown's office, but I'm offering you, these are the services that are available within the county. And that's where it just kind of gets sticky, because I can't promote one over the other.
Marketing also would help a lot, because I mean, there's a lot of people out there that don't know what we have. I mean, they don't know the programs that HealthLink has, the hospital has, the doctor's offices. We also have another new doctor's office in Stark County. I've heard a little bit about, but people don't really know what kind of access they have. And so that might be a good thing to do too, is, work on marketing.
I can tell you a couple of counties have done different things. So some have hired somebody in-house to do marketing. Cass County, I think, is very interesting. They have a company that they have hired to do all of their marketing for them. So they pay them, they send them the information. Cass County will even make their own videos while they're at an event, let's say a vaccination event, and then they send it with their iPhone. they send it to this marketing company and then they upload it and they make it look nice. And so it reaches the masses through Facebook or Instagram or places like that. So there are definitely are options and ways to spend money on that. And that's a great use of this fund.
We
Well,
gotta have some programs in place before we worry about marketing them.
We have 7 council and 3 commissioners that can help market to people too. You know,
And I'll throw this out there too. You mentioned a CD, but one thing that's really long lasting, I don't know if it's the lab, but an endowment. That's the other thing that'll last for a really long time. So if you can throw money into an endowment and draw from it over time, that's one way to have something long lasting that won't go away.
That's something I looked into with
That's
the
been
Carson
really-
program I just started. It's just, I can't put
We're glad
any
to
county funds into it to start it, so now I'm more required, now I'm relying on donors. But, yeah, I've collected some information on it and that from Community Foundation.
We also want to thank the hospital too for offering to help us with EMS. during that
Absolutely.
dark incident. Appreciate that.
Exactly.
All right.
Is that it? No?
Bye,
Get Renee a car seat yet, Lori?
Not yet.
All right, good.